Hey everyone, Jexie here. Welcome back to another video. In this video, we're going to discuss the concept of recovery programs not being a one-size-fits-all type model and how different people may choose different routes to recover, and it doesn't necessarily mean that one's better than the other. So for the context of this video, when I'm talking about a recovery program, I'm talking about whatever a person's doing to stay off drugs, alcohol, drugs, heroin, whatever. Whatever a person's doing to live a life free from any substance, that's what I mean by recovery program. So I'm not talking about, we can go into some of the specific types of programs there are, but in general, when I talk about a person's recovery program, I'm talking about just their day-to-day life and what they're doing to stay off drugs. So there's a lot of different options out there for recovery programs. There's 12-step programs, which are probably the most common. The two that you hear of most are AA and NA. However, there's a whole list of them. And they all are kind of based off the same 12-step model, but they're not all exact replicas of each other. I would say that there's a lot more differences between AA and NA than what most people know, and I guess since we're talking about it, I'll just go into a couple of them. So NA is not just AA, but with drugs. Yes, AA is about staying off of alcohol. NA is about addiction. NA is not specific to any one drug, even though the name would suggest that it is. A lot of people are confused by that. Narcotics Anonymous is just the name because Addiction Anonymous would be AA. So they use drugs and they define drugs as any mood or mind-altering substances, and they include alcohol as a drug in that program. The differences between AA and NA are subtle, but if you were a member of either program, you probably know what they are. For example, AA has a reading that's called the promises, where they give a list of things that will happen to your life if you stop drinking. So pretty much that life will get better for you. NA actually doesn't say that. NA is very clear that they can't make any promises about your life getting better because life on life's terms can just be difficult. What NA promises is freedom from active addiction. So those are some of the main differences. But for the most part, the idea is the same. The concepts of those programs are faith-based. You don't have to necessarily, AA is a little bit more God-centered, where NA is more higher power. They're not so specific as to, they don't use the word God as often, even though it is used. It's more of a faith in something greater than ourselves. So those are kind of the big differences between the two, but they both fall under the term of 12-step programs. And I was talking to somebody earlier today, and they had mentioned that a friend of theirs had posted something on Facebook saying how they stopped going to NA meetings and their recovery's never been better and everything's wonderful. And if you talk to other people in 12-step programs, they'll tell you that if you stop going to meetings, that's like the first sign of relapse. So those seem to be like two contradictory statements. And what I would say is that they're both true. It depends on who you are. So some people do really, really well in 12-step programs. For myself, like that's the program that I choose to follow for my recovery. But I don't judge people who aren't a fan. I think that depending on what your reasoning for not being a fan, that's what matters. So, for example, I would say that in some areas, NA is newer than AA. And therefore, in some areas, especially rural areas, you'll find that there just are not a lot of NA meetings. So a lot of people who are addicted to heroin, say, will go to AA. And in some areas, that's perfectly acceptable. In other areas, if you go to an AA meeting and you share about using drugs, you're made to feel like you don't belong. That's not the program. Those are people. And I think that's really important to separate. The programs and the people in the programs are not the same. So I could give you all of my opinions on 12-step programs, But that doesn't mean that I am a guru of any program or that my opinions are more valid than anybody else's. I can just tell you my experience, and my experience is that these programs work. But that's my experience. If I went to a meeting, and I'll share, the very first time that I went to an NA meeting for myself, I was in withdrawal. I was absolutely miserable, and this was a few months before I actually made the decision to get clean. But I had been in withdrawal for a couple of days, and I don't even remember why I went. I was sick and tired of being miserable, and I decided to check it out. So I drove like 45 minutes because I was living in a rural area at the time, and that was the closest meeting there was. And I sat in the back of the meeting, and I cried the entire time. And I feel like I stuck around after the meeting to see if anybody would talk to me. It is possible that I just kind of ran off. I don't really remember. My feelings were that I stuck around for a little while and that nobody came up to me. Nobody spoke to me. Nobody acknowledged me. Nobody said it'll be okay. And I didn't think I'd ever go back. Because I had a history and I had known about NA meetings because of other family members' involvement in it, I decided that I wasn't going to let that one bad experience sway me from ever trying again. And I went to another meeting the next day, and my experience was completely different. The people there were much more welcoming. They were much kinder. Some people even mentioned that they had seen me the night before and that maybe I'd run off before they could talk to me. So because I gave it a second chance, because I went back a second time, I was able to realize that maybe my first impression was not the most accurate. I had been back to that meeting since, and although it was a larger meeting, it wasn't really one that I ever really felt super welcome and comfortable in. Other people would tell you it was the greatest meeting around, right? So I think finding a place where we feel like we fit in is what's important. And so there's also programs like Smart Recovery that does a lot of the program online. They are also an abstinence-based program. However, they do think that some people can use on occasion. I don't know that that's something that I personally think is a good option. I know for me, it's not worth the risk. So I would rather stay with a program that is abstinence-based. There are other people that do religious programs, or they go through psychologists or psychiatrists, and those are working for them. I'm not sure that that would work for me, but I'm not going to judge somebody and say that because it wouldn't work for me, it's not going to work for you. I think we have this habit of assuming that the program that we do is what's best for everybody. And I just think that we need to recognize that that is not the case. Some people have to go to long-term rehabs. Some people can quit cold turkey and never pick up again. Some people need to go to meetings every single day in a 12-step program, and some people decide they're not going to use anymore and they just stick with it and never pick up. I don't understand how people do it, but I know that they've done it. I've seen people stay clean for years just making a decision not to use anymore. Could we argue they're not addicts? Maybe. But the fact is that if we treat recovery like a one-stop shop, that like everybody's program needs to be exactly the same, we're discrediting the individuality of people. All our needs are slightly different. We respond to stuff differently. We deal with situations differently. I think that part of recovery and part of working a good recovery program is finding where in this spectrum of programs you feel that you're getting the most help from. And also being flexible to know that if you're not getting help in one place, that there's other options. I know people, there was a program called Celebrate Recovery that was based on 12-step program principles and religion, and they used them both together. They used a religious model and a 12-step model like merged. And a lot of people loved it. It had the best of both worlds for people who were very religious, but also like the 12-step program. So there's a gazillion options out there. And I think what's important is that when we talk about recovery programs, we should be able to be open about why certain programs for us are successful, why we like them, maybe things we don't like, or what we would suggest for people who had a bad experience. For example, I would tell somebody who went to an NA meeting that had a horrible experience to go to another meeting in another place at another time on another day and try again, because meetings are made of people And look, if you're a 17-year-old young female and you walk into a meeting filled with all older 40, 50-year-old men, you're not going to feel like you belong. You're going to have trouble feeling like these are your people. It's not the program that's the problem. It's the meeting. It's the people, right? Other times you may find a program, like maybe you're in Smart Recovery and you decide that, like, yeah, I can drink on occasion, and you try that and you fail. Well, maybe that program's not for you. I think abstinence-based programs are the safest because there's no risk. I don't have to risk my life using, right? I don't have to try to see if I can live like a normal person does. For me, I think that's dangerous. But I'm also not going to judge people. I know people who were in recovery for a long time and decide that there's a substance they can use on occasion. Maybe they're going to smoke pot every other, on weekends or whatever. I don't judge them. I know that can't be me. I know that I need to stay off of everything for good because that's what's going to keep me on a good path. But I don't judge other people for what they choose to do, right? So, like, let's say you get in a car accident and break your leg, and your doctor gives you two choices, and you're in massive pain. You can take opiates, or you can smoke pot. But you have to pick one. Well, what do you do? If your recovery program says, well, if it's prescribed by a doctor, it's okay, well, technically they both are. So where do you go? What do you do? What's safer for you? And I think that if we don't talk out loud about recovery programs being an individualized process, and we give one answer to questions like that, regardless of the person, we limit the help we're giving. For example, if you're a hardcore opiate addict, maybe you'd be safer smoking pot if you broke your leg. Whereas if pot was your drug of choice, maybe it'd be safer for you to take a couple of painkillers until you were healed. I don't know, but the fact is there's never one right answer. So by talking to each other and figuring out what works and what doesn't, and getting to know the options of programs out there, we're more likely to be able to figure out what works for us and how we can stay clean. We don't need to judge people. All of my videos say the same thing. We need to stop judging people, and we need to be more open about recovery. When people feel like they're going to get judged for their opinions, they're not going to share about it. And then how do we help? So I hope you enjoyed this video. Again, these are just my opinions, and I'm never ever going to say that one way is better than another. Even if I think that one way may be better for me, I will never tell somebody that I think that way is better for them. It has to be a personal choice. So I would love to hear what programs you're familiar with, what programs you think are best for you. Have you seen programs work for other people that you would never do? I would think that this would be a great conversation so that down in the comments, people who aren't really familiar with recovery can kind of get an idea of what's out there, what works, what doesn't work, what do people think. So I hope you enjoyed another video, and I really, really look forward to seeing you guys next week. Have a great day.